we'll discuss the psoriatic arthropathy. So the joint involvements in psoriasis, it is seen only in 5 to 10% of the cases of patients who are having the psoriasis. They have the joint involvement also, only 5 to 10% of the cases. So what are the various types of psoriatic arthropathy? We have the 5 types of joint involvement in the patient of psoriasis. There are 5 types of psoriatic arthritis. The most common being the asymmetric psoriatic arthritis, and it affects about 40% of the patients. So 40% of the patients having the asymmetrical psoriatic arthropathy, that is only one side of the body is involved, or one side of the joint is involved, like this is shown in the diagram, and one side of the body is subdued and one side is involved. So it is asymmetric psoriatic arthropathy, and it only causes the milder pain, and this asymmetry can convert into the symmetric psoriatic arthritis. So this is one type, that is the asymmetric psoriatic arthritis. And then we have the another, that is the symmetric arthritis, and it involves in 25% of the patients of psoriasis suffer from symmetric psoriatic arthritis, in which both the sides of the bodies are involved, both the hands are involved, and it affects both sides of the body and causes very severe pain, and it often occurs after the asymmetric psoriatic arthritis. So asymmetry will convert into the symmetric arthritis. So this is the symmetric psoriatic arthritis. And the most characteristic is the distal interphalangeal. It is the most characteristic distal interphalangeal predominant psoriatic arthritis. Here the only distal interphalangeal joints are involved as shown in the diagram. So distal interphalangeal psoriatic arthritis, and it affects about 15% of patients who are having this psoriasis will have this characteristic distal interphalangeal psoriatic arthritis. Then another arthritis is the spondylitis arthritis. Here the back is involved, and it is seen in 15% of the patient of psoriasis will have this spondylitis arthritis. Here the inflammation primarily targets the spinal column, and which results in painful stiffness in the neck and lower back, and sometimes the sacroiliac region is also involved. Then we have the arthritis mutilans, and it is the rarest form, and it affects only 5% of the patient of psoriasis will have the arthritis mutilans, and it is the rarest and most severe form, and it affects less than 5% of the patient, and it can lead to the severe deformities of the hand and feet, and if it is not properly treated, the deformities can occur in both hands and feet. So these are the types of psoriatic arthritis. Now we'll see what are the types of psoriasis. So here we can see the types of psoriasis. We have the plaque psoriasis, then we have the guttate psoriasis, then we have the pustular psoriasis, then we have the scalp psoriasis, then we have the nail psoriasis, and then we have the psoriatic erythroderma. So in nail psoriasis, in plaque psoriasis, you will find it is the commonest type, and here we will find the coin-shaped or nummular lesion. Coin-shaped lesions, or we also call it as the nummular lesions. Nummular lesions. So it is the commonest variety, that is the plaque psoriasis. Then we have the guttate psoriasis. Here we will find the raindrop pigments on the skin surface, as we can see here. That is the guttate psoriasis. Then in the psoriatic lesion we will find the pus, and it will be seen in the palms and soles. So this is the pustular psoriasis, seen in the palms and soles. Here the pus is found in the lesions. Then we have the scalp psoriasis, where the scalp is involved, and the scalp psoriasis does not lead to alopecia. So alopecia does not occur in scalp psoriasis. So alopecia usually does not occur. Then we have the nail psoriasis, and then we have the psoriatic erythroderma. So psoriatic erythroderma will lead to the exfoliative dermatitis, and it is very fatal, and it is fatal. So exfoliative dermatitis is very fatal condition. Then we have the other types of psoriatic lesions, like we have the nail psoriasis. It's a big topic in itself. Then we have other types of psoriasis, like we have this genital psoriasis. Genital psoriasis, where the penis and the vulva is affected. Penis and the vulvas are affected, that is the genital psoriasis. Then we have the flexural psoriasis. Flexural psoriasis. Flexural psoriasis is also called as the intertriginous psoriasis. Intertriginous psoriasis. And in flexural psoriasis, the flexure sites are involved. The flexures are involved. Normally in psoriasis, the extensor surfaces are involved, but if the opposite occurs, that is the flexure is involved, then it is the flexural or intertriginous psoriasis. Then we have one more psoriasis, that is the rheumatoid psoriasis. What is rheumatoid psoriasis? Rheumatoid psoriasis. In rheumatoid psoriasis, the lesions are very hyperkeratotic. Here the lesions are hyperkeratotic and cone shaped. So hyperkeratotic and cone shaped lesion is rheumatoid psoriasis. Rheumatoid psoriasis. Then we have the one more psoriasis, that is the generalized pustular psoriasis. Generalized pustular psoriasis. Generalized pustular psoriasis. And it is very rare, but it is very serious. It is rare and it is serious condition, and it is also known as von Gumbusch psoriasis. Von Gumbusch psoriasis. Then we have one more psoriasis, that is the inverse psoriasis. So what happens in inverse psoriasis? The skin folds are involved. What is inverse psoriasis? In inverse psoriasis, the lesion is seen in the skin folds. Here the skin folds are involved, that is the inverse psoriasis. So these are the various clinical forms of psoriasis. Then lastly, I will like to discuss here what are the conditions where you will get the exfoliative dermatitis. Exfoliative dermatitis. So you should be knowing what are the conditions where you will find the exfoliative dermatitis. So as we discussed, we can see it in erythrodermic form of the psoriasis. So you can see it in psoriasis itself. Then you can see it in contact dermatitis, atopic dermatitis also. Then you can also see it in pityriasis rubra pilaris. Then there are certain other conditions like we have the drugs can cause like dapsone and sulfonamides. Dapsone and sulfonamides can also cause. Then some systemic illness like lymphomas, like we can have the lymphomas can cause. Then carcinomas, multiple myeloma, and HIV infection, where you will get the exfoliative dermatitis. So this is all for today.